This is the part 3 of the video gene panel sequencing and the prediction of breast cancer risk.
One of the best benefits about these panels is that we can kind of mix and match what we need a little bit, and there's several different panels that Ambry offers. One for breast cancer that looks at the 16 different genes. That's the big next-gen panel. But then there's also a smaller one for, I believe, 6 different genes that are very high-risk gene panel that actually comes, turnaround time is the same or similar to the BRCA genes. So we really got the advantage of next-gen sequencing without having to wait the long length of time for the largest panel that they offer. So that's a benefit to doing the next generation sequencing, and I think that that's really attractive to the patients, and it's really helpful for us as genetic counselors. So they have this really great policy where they will contact me if there's any out-of-pocket cost for the patient that exceeds $100. So there's a pretty low risk, especially if the patient does meet criteria that we looked at beforehand, and we send it off. And once it goes through their insurance verification process, if it goes through that, we can pretty much tell the patient that they're not going to have a bill of thousands of dollars for one of these tests. So that's really great on the patient's side, because they're always, the question that I get is, am I going to get a bill for $4,000? I heard that this test costs $4,000. And, you know, we can be very reassuring, especially when we're working with Ambry, that we know that even if something happens in an error, that that we'll be able to work with the laboratory to make sure that the patients and genetic counselors are all on the same page about how much the test costs and what the patient will owe if they do. Just recently, we had a case where a young woman, unfortunately, came in with a diagnosis of breast cancer, a recent diagnosis of breast cancer. This was a couple months ago, and she, really given her age of diagnosis, and she had an extensive history of pancreatic cancer as well, we really weren't sure what to order for her. And we knew that she was going to be pending surgical decisions. So she was going to be deciding whether or not to treat her breast cancer by removing just a part of the breast, which is kind of the standard treatment for a local breast cancer, or if she would be doing something more dramatic, like having both of her breasts removed, because of a concern about a risk for a future breast cancer. So she came to us saying, I'm trying to decide between these two alternatives, and I really want to know if I have some kind of hereditary or genetic susceptibility that led to my cancer, so that I could make the most informed decision, because women that have a hereditary form of breast cancer are more likely to get another breast cancer in the future. So we, at that time, went ahead and ordered, normally, or in the past, we would have just ordered the standard BRCA1 and BRCA2 genetic tests for her, because that was the standard of care up until really recently. But the benefits now are that we can, especially the Ambry's new tests, we can order a panel that looks at almost all the genes that we know of, not quite all, but almost all the genes that we know of that can contribute to early age of onset of breast cancer and a strong family history of breast cancer or other cancers. And those other genes outside of BRCA1 and BRCA2 can account for a significant portion of these families, even though individually each one of those gene mutations that we find are going to be rare. So she went ahead and did that panel test instead of just going for the stepwise procedure, and they actually found a gene mutation in one of the other genes, the non-BRCA genes, which really, she was thinking, when we met with her the second time, we met with her to talk about the results of the test. That result really led her in a direction that said, okay, I am in a higher risk category. I think that I want to go forward with what we were kind of thinking about before of being more preventive and proactive about bilateral mastectomy. Also, it may or may not have, or it may have an impact on her treatment as far as her radiation exposure and things like that. So that was a really good way that we used the panel, and it returned us results in time, and we were able to use it, and the patient felt like this was information that her and her family could use. Additionally, the family history was consistent with what we found, and so we were able to, well, we're still in the process of discussing with the family whether or not they want to get genetic testing to find out who's a carrier of the same gene mutation, and if they would qualify for any early enhanced screening, based on these results. Women that test positive can opt for surveillance of the breast tissue through MRI and mammography, or they can take other options, like there's what we call chemoprevention. There's drugs one called tamoxifen can reduce the risk for breast cancer by about 50%. Also, oral contraceptives can decrease the risk for ovarian cancer, and also surgeries like bilateral mastectomy or risk-reducing removals of the ovaries can be done, depending on the situation and depending on the person, what they may opt to do. We have a backlog of lots and lots of patients who we've been testing for years and years and years, who have only been tested for BRCA1 and 2. And we, as a genetic counseling community, it's a big question out there. What do we do about going back to all of these cases and looking through their family histories and looking through everything, and then going back and offering them a test that can look at all these other new genes? Because a lot of those genes on these new, like in the panel tests, may really change the outcome for these patients. But they weren't tested for a few years ago because it just wasn't it wasn't standard of care. And really, there weren't even guidelines for these genes, or maybe the genes were hardly even discovered at that time. So we couldn't test for them. So that's a big question in the genetic counseling community, is what do we do? How do we get these people to come back in? Because a lot of people are out there probably walking around with not a lot of people, but a lot of people that were evaluated initially for a BRCA mutation very well, especially if they have a strong family history, very well may have a gene mutation or a hereditary cause to their breast cancer that could be picked up today. And so, we're working on that. We're trying to have some people come back in who are particularly high risk, or have a particular concern about their family history, or have reevaluated with their doctor recently. So hopefully we'll be able to give them some answers. Ambry, in my experience, they've been really responsive and really attentive whenever I needed clarification of something on a test report. So going back to an example that I had earlier, this patient had a test result in one of the genes on the breast next panel that was in a gene that we know a little bit about, but there's just not a whole lot of information. There's not a whole lot of huge studies that have been done on people with those particular types of gene mutations, and there's not a whole lot of people that have been diagnosed with this in the past. So the benefit was that at Ambry, I was able to give a call to the customer service line, and they put me in touch with one of the genetic counselors, actually one of the genetic counselors who was part of developing putting together the literature and developing the test reports for the breast next panel. So she was really the most informed person in the genetic counseling community, anyway, that I could find at that moment, to give us an idea of what they've seen on the breast next panels that have gone through, what kind of results have looked like the one that we got, and what did that mean for the other families that they had seen. And so she could walk me through what they've already seen, what they've learned since doing this test, and what it might mean for my patient, and what we may be able to give my patient as a little bit of extra information. So I felt like they were able to give me really the most up-to-date and current information. By talking to a genetic counselor, you kind of feel like you're talking to somebody who understands the same perspective that you have and understands the same need that the need for information that your patient has, and puts it in a way that you can explain it back to the patient very easily.
Thank you.